We are here today to talk about how healthcare reform will bring security and stability to middle-class Americans, not only in North Carolina, but around the country.
I think our main focus on trying to make sure that middle-income families are protected as we move forward in healthcare reform is to deal with the cost of healthcare. Under our current system, middle-income families are jeopardized on being able to maintain their current health insurance coverage.
In North Carolina, insurance premiums have grown 5 times faster than wages. In 1996, family premiums were about $6,000. Today, they're $12,000. Currently, it's expected in 2016 to be $24,000.
Now, how can you possibly, with an income of $50,000, get by paying $28,000 for health care? You're not going to be able to do it. What you're going to do is buy less. You're not going to have your present plan. You're not going to be able to have a lot of the things that you're used to, because you're not going to be able to afford $28,000, or you're going to go into medical bankruptcy.
What kind of a health insurance system is it that drops one's health insurance because you got sick? What kind of a health insurance system is it that says, we're not going to pay you anymore because you got sicker than we thought you would? It's time for change in the health insurance system in America.
1 out of every 3 individuals who try to seek private insurance find that the insurance company want to restrict their coverage because of pre-existing conditions. We need to change that, and the bills that are moving through Congress will, in fact, change that.
American families and small business owners will no longer be denied health insurance based on pre-existing conditions. And insurance companies will no longer be able to charge exorbitant premiums for customers who have pre-existing conditions.
The bill's focus is to help small companies. Small companies today are discriminated against in our health coverage. Many middle-income families are struggling to maintain small businesses or work for small businesses. In a recent study, 40% of the small businesses in America said that the cost of health care is impeding their growth. Well, that's where our economy grows. That's where jobs grow. We need to do something about that. Small companies, on average, pay 20% more for the same insurance coverage that a large company has. 20% more. Oh, that's not fair.
It's just collapsing for small businesses. And again, my story, I think, is the same of the majority of most small businesses. It has become the norm for businesses to compromise insurance.
The small business owners I talk to every week in North Carolina, they want to provide health insurance for their employees, but it's just too expensive in many cases. North Carolina's small businesses and self-employed entrepreneurs spent $3.8 billion on health care premiums just last year, and that number is going to rise to $9 billion by 2018 without health care reform. This bill will provide small businesses with a tax credit to cover their employees.
The local exchanges will help small businesses. It will provide more competition, more choice, so small businesses can get in larger pools, can have the benefit, as large companies do, in larger pools. So we're going to continue to say that one of the primary reasons we've got to get this done now, the urgency, is to help middle-income families to be able to afford health coverage, to be able to continue their health insurance, to have affordable options, to be able to find an insurance product that's affordable, to offer more competition, to take on the private insurance companies. For all those reasons, we need to move forward with health insurance reform.
We are working hard to pass this reform bill for middle-class families so people no longer have to fear sinking into bankruptcy as a result of a medical emergency.